Is quetiapine safe during pregnancy? Have you ever wondered about the safety of medications during pregnancy, especially when it comes to mental health? Today, we will discuss quetiapine management in this context. Quetiapine is an atypical antipsychotic medication commonly prescribed for conditions like schizophrenia and bipolar disorder. When considering its use during pregnancy, it is essential to weigh the potential benefits against the possible risks to the fetus. Currently, there are no well-controlled studies that specifically evaluate the safety of quetiapine in pregnant women. This lack of research makes it challenging to draw definitive conclusions. However, observational data from many pregnancies where quetiapine was used suggest that the risk of major birth defects does not significantly increase compared to the general population. Some studies have even reported no major malformations in infants born to mothers who took quetiapine during their pregnancy. That said, animal studies have indicated possible embryo-fetal toxicity. There is also a potential risk of complications in newborns exposed to quetiapine, particularly if the exposure occurs during the third trimester. These complications may include withdrawal symptoms or movement disorders such as agitation, tremors, and muscle tone abnormalities. Some newborns may experience respiratory distress and feeding difficulties, with a few requiring intensive care and extended hospital stays. Additionally, there are concerns related to the use of second-generation antipsychotics, including quetiapine, during pregnancy. These concerns include increased risks of miscarriage, preterm birth, low birth weight, and pregnancy-related hypertensive disorders. However, it is important to note that these risks may be more related to the underlying mental health conditions rather than the medication itself. Comparisons with unmedicated women with similar psychiatric diagnoses show less pronounced differences. From a substance abuse and addiction perspective, it is vital to take quetiapine strictly as prescribed during pregnancy. Misuse, such as taking higher doses or combining it with other substances without medical supervision, can increase risks for both the mother and the fetus. Pregnant individuals using quetiapine for non-medical reasons or beyond prescribed amounts should seek harm reduction support and medical guidance. Improper use can lead to adverse pregnancy outcomes and potential involvement of child protective services. In clinical practice, healthcare providers carefully consider the risks of untreated psychiatric illness against the potential risks of quetiapine exposure during pregnancy. For some women, continuing quetiapine may be necessary to maintain mental health stability, which is essential for a healthy pregnancy and parenting. Close monitoring by healthcare professionals is crucial, and alternative treatments may be considered when appropriate. Quetiapine is not absolutely contraindicated during pregnancy, but it should be used with caution. Its use is justified only when the benefits to the mother outweigh the potential risks to the fetus. Pregnant women taking quetiapine requiring careful medical supervision to manage both mental health and pregnancy outcomes safely.